So, Dr. Chill, I feel like this is where putting it together is always the fun part, right? Because it's like, okay, we talked about this strategy and this strategy and this strategy. Now tell me, how do I put it all where I have when I'm seeing my patient tomorrow morning, right?
Right. Exactly. How do I put it in the clinical setting, right? And this is what we go through in our coaching sessions with every practitioner is to like, because every visit is going to be slightly different. And we'll go through how to kind of personalize all of your visits for your patients. But there is a flow that you can look at following, right? This is the clinician's flow for integrative care. So now that we understand all of these strategies, the way to put it together is to first evaluate everything, right? You want to look at what are their underlying factors. We can evaluate things like what is going on with their lifestyle that's happening that might be putting them into an imbalance. What are some environmental things that they may be exposed to? What are other factors that are influencing their condition, right? That is evaluating. Then next, once you figure that out and we have tools that can help you evaluate what their underlying factors are, the next thing that you can do is educate them on what's happening. You're going to explain what all of the root causes are or all of the contributing factors to their underlying imbalances. And this is going to help the patient understand exactly what's going on. And your patients are going to love you. The biggest thing that we often hear from in functional medicine is that from our patients is that this is the first time with the patients saying this is the first time that they felt they were listened to. And when you are educating the patients on the why, your patients are going to feel listened to. And when they feel listened to, they're going to be empowered to do whatever you say. And they're going to be empowered to really start to improve their health in all of these different strategies that we're talking about, right? So now that we've evaluated what is going on and we've educated the patients on the whys of what's happening with them, we can start simply with your patients, right? You can provide something that's actionable, like a lifestyle recommendation or the nutritional recommendations, right? Something like the mindfulness that we were talking about. Then we can go into the fourth aspect, which is the dietary guidance or the nutritional guidance, with offering one or two simple solutions that they can start to add in. It's not necessarily take away. We want to focus on adding for them in the beginning here. And then you could go into different supplement strategies and personalizing those supplement strategies based on their imbalances, right? You want to start with maybe recommending one general supplement and then 1 to 2 targeted supplements. We don't want to throw everything at the patient, right? We want to personalize this based on their health goals, what their needs are, what their imbalances are. And this allows us to properly monitor our patients and what's going on so we can make the necessary adjustments. If you throw too many supplements at your patients, you're not going to know which supplement is working, which supplement isn't, which supplement you need to be adjusting. That it makes it really difficult to monitor with your patients. And that's the main framework of everything, right? Evaluating, educating, and adding in all of those different strategy components that we talked about and making it as easy as possible for your patients.
Yes, absolutely. And I love the picture that kind of shows us the simple steps, right?
Mm-hmm.
It's the first one is look at the epigenetic factors, right? Now, when you're in the advanced program, we already do the hard lifting for you. So utilizing the evaluation tool, give it to your patient, ask them to fill it up before they're coming into the next session. And when you get the results back, right, we give it to you as a PDF. The patient can fill it up, save it, and then upload it to the EMR. Or for older patients, we used to print it in our clinic, used to print it out, give it to them and say, fill this up at home, come back next time, a few minutes before your appointment to allow us to review it. And now where you're reviewing it, you're like, oh, they got high symptoms, high amount of signs and symptoms in the bacterial dysbiosis or heavy metals or nutritional deficiency or certain neurotransmitter imbalance or HPA axis, right? That from there helps you to say, okay, these are the top 2 things I want to focus on. I'm going to look at my clinical guide. And in my clinical guide, what is the top treatment strategy or supplement or lifestyle, something, or what is the lab that I need to talk about or order, right? So, and that's exactly why we also have the clinical mentors like Dr. Chill, Dr. Esha, Dr. Kim. They can go with you over it. And when you bring case studies, either yourself, family member, a friend, real patients that you're starting to use these methods with, just book a call. We are covering the cost of it. It's part of your program. Book a call with the mentor and the clinical mentor, and we'll help you we'll help show you how you can put it all together very quickly, right? But as Dr. Chill said, it's very simple. It's like you pick like, okay, one supplement, one this. You can even do like in this session, I'm just gonna pick like to talk to them about like one root cause, one supplement to reduce inflammation, and one dietary guidance, right? Next session, 2 weeks later, how everything went, get some feedback, then apply, okay, what's the next supplement I can talk to them about, more specific to maybe their autoimmune condition, maybe rheumatoid arthritis or Hashimoto, whatever it is. And then what is one lifestyle strategy that we can integrate now for the next 2 weeks, right? So it's almost like you're building it very slowly. Every time you see them, you just build it. You ask, you get their feedback, because we're doing it slowly, not just to not overwhelm them, like Dr. Chill mentioned, but also the real goal behind all of this is not just temporarily reduce their inflammation, reduce the exposure to the insulting factors, but we are trying to create habits that will follow them for the rest of their lives, right? Because that's what we all want in our heart. That's what we all want for our patients. We want them to get better and carry on this work, right, for the rest of their lives. I also love it, and I'm sure, Dr. Chill, you had that before, but I love it when patients come back and they say, oh, I didn't know this about sugar. I've been giving my kid, this cereal in the morning. It has tons of sugar, right? I didn't know about this processed food, or I didn't know about this, or I didn't know about that. And now I changed my family also diet. So my kid is doing better at school, right?